Hi friends, I am Dr. Krishna Kumari. Welcome to Sparsh Homoeopathy. Today we are going to discuss the medicinal management of tonsillitis. Of course, Belladonna is the chief medicine at the commencement of tonsillitis. If the Aconite and Ferrum has passed the stage, if it is indicated. First, we are going to discuss about Aconite. Aconite, all the complaints come suddenly, very violently, and it appears like a storm. That much intensity is there in Aconite. Aconite, the complaints can occur from exposure to dry cold wind. If a plethoric person who is suffering from severe sore throat with high rise of temperature at night after exposure to dry cold wind, we can think about Aconite. Then other causative factors are exposure to drafts of cold wind, checked perspiration, etc. There can be dryness of throat with burning, unquenchable thirst for large quantities of cold water. And there is dry heat on the surface of the body. Then there is intolerable pain. Patient cannot tolerate pain, which makes the patient mad. And the pain aggravates during evening hours and also at night. And patient is need open air, and patient needs cold and open air. Aggravation, inside the warm room, there is aggravation. And there can be burning pain, and the tonsil is very red in color. Then along with there is anxiety, fear and restlessness. The sensitivity of throat to touch, the scraping sensation and the burning pain, etc. are similar to that of Belladonna, but the anxiety, fear and restlessness, which differentiate it from Belladonna. And the patient shows restlessness, patient wants to move from place to place, and this movement which will not give any relief. And patient shows fear and anxiety that the disease is incurable because of the intensity of the complaints. All the complaints comes very violently, so the symptoms are highly intense and patient thinks that the disease is incurable. And the patient predicts the time and hour of death. Then comes the medicine Ferrum. Ferrum is also a remedy for acute inflammation of tonsillitis, and the tonsil is very red in color and inflamed, very hot, and it is right-sided. And the peculiarity is throat is very sensitive to touch, like that of Belladonna, but it is better by cold application. And there is no anxiety and restlessness similar to that of Aconite. Then the Ferrum face is were red in color. There is no dusky hue color discoloration like that of Gelsemium. And Ferrum face is more active than Gelsemium. Next comes Gelsemium. Gelsemium, the complaints can occur from exposure to cold wet weather. But after several days after the symptom comes, and the temperature is usually mild in nature, and the differentiating point is Gelsemium patient is very dull, dizzy and drowsy. And there can be headache and vertigo, and patient shows chilliness and thirstlessness. Tonsil is red in color and difficulty in swallowing. And this difficulty in swallowing due to weakness of muscles of throat. Then comes Gelsemium. Here it is indicated in the follicular type of tonsillitis. Follicular type means the inflammatory exudate collects in the tonsillar crypts and it appears like a white spot on the surface of the tonsil. Here in Gelsemium, the tonsil is grayish in color with white spot on the surface of the tonsil. It is indicated in acute and chronic tonsillitis. And there can be inflammation and induration of the tonsil and other glands of the neck, and it is very difficult to get breath because of the enlargement of the glands of the neck and tonsils. And it is indicated for hospital sore throat. Base of the tongue, it is grayish in color, and there can be radiation of pain to ear. And this Belladonna follows well Gelsemium. Then Belladonna is the next medicine. It is an important medicine for tonsillitis, and the throat and it is for catarrhal inflammation of the tonsils where there is much congestion and redness. The throat is very dry and hot in nature. Mainly right tonsil is affected, and throat is very sensitive to touch. Then there is a scraping sensation in throat and sensation of lump in the throat with a tendency to swallow frequently. And there is difficulty to swallow because of the spasmodic constriction of the muscles of deglutition. So the water drink is omitted out. Then other glands of neck also involved. Along with this, then rapid ulceration on surface of the tonsil in belladonna. Along with this, the general symptoms are also found in belladonna. There can be high rise of temperature, and the head is very hot, and the face is very red in color with the coldness of the extremities. And tongue is strawberry red in color, and the fauces, throat, etc. very red in color. Then along with this, there can be headache, and there is rush of blood to head with throbbing of carotids. And the belladonna patient is chilly in nature, so the complaints better by warmth. And it is indicated in acute cases or acute exacerbation of chronic inflammation. And it is followed well by calcarea car, and is the complementary of belladonna, complementary remedy of belladonna, and hepasulf, mercurius, silicea, etc. follows belladonna. Then comes guaiacum. Guaiacum, also at the commencement of tonsillitis, there is catarrhal inflammation of the tonsils, and tonsils very red in color, dark red in color, and there is violent burning pain. There can be headache and chilliness. There can be aching of muscles of neck and back, etc. And it is called rheumatic sore throat. So rheumatic complaints along with the tonsillitis. Then calcarea follows well this guaiacum also. Then epismel, it is also an inflammation, the catarrhal inflammation of the tonsils. All the tonsils and glands inside and outside is enlarged. There can be very deep redness of the tonsils, fiery redness of the tonsils with much swelling. So if the redness is more and swelling is more, we can think about epis other than belladonna. There can be burning, stinging pain in throat, which is better by cold application. The epis is very hot patient. There can be dryness of mucous membrane with thirstlessness. And right tonsil is mainly affected with a sensation of constriction in throat. Then there can be numerous pits of exudates can be found on the surface of the tonsil, and better by cold and open air. Aggravation hot externally, very hot patient, so externally and internally heat produces aggravation. So warm drinks produces aggravation in epis, and complaints burst after sleep. Then it is indicated for much swelling and deep redness than belladonna. And Guaiacum is the complementary of epis. Then comes Phytolacca. Phytolacca is also for a remedy of follicular tonsillitis, and there can be pain at the root of the tongue which radiates to ear, and there can be burning pain like that of hot coals, or fire is applied to the affected part. There can be dryness and very difficult to swallow, and there is a sensation of lump in throat with the constant desire to swallow. And here aggravation from hot fluids. Tonsils are swollen and dry in nature, and the color, the tonsils may be dark red or bluish in color. Then cold weather aggravation and warm weather amelioration, but patient cannot drink hot fluids. And for local application, we can gargle Phytolacca tincture to reduce the inflammation of tonsils. Then comes Ignatia. Ignatia for follicular tonsillitis, it is a remedy of contradiction, and there can be small superficial yellowish white spots on the surface of the tonsils, better by when swallowing, and a pain in between the act of swallowing. And the drinking liquid is more painful than solids. Then comes Amygdalus amara. The symptoms are very similar to that of belladonna. Throat is dark red in color, and there is a sudden sharp pain which pierces the tonsils. And here the prostration is well marked, similar to that of Ferrum.